Hey guys, it's Danielle again with Pure Root Wellness. Today we're going to talk a little bit about the pancreas, acute and kind of chronic pancreatitis, and then just supplemental support to help with not developing pancreatitis, or what you can do if you're dealing with more so a chronic pancreatitis, not so much in the acute phase. So, what is the pancreas? What does it do? Really has two roles. First, it works as a secreting gland, an exocrine gland, where it releases enzymes to digest the starch, the fats, and the proteins, basically. And you have all these enzymes that are attached to the starch, the fat, the protein that help break each one of these properties down. The second role is it helps to actually secrete hormones, which is the endocrine function of the pancreas. Its action really is like it's insulin and glucagon. This is what helps kind of regulate your blood sugar either up or down, and really kind of drives is the driving force with how much insulin is being in the system, and where your blood sugar kind of lies. And you can see it's kind of where it's located in the body, kind of tucked up, a little closer to the liver. There's your gallbladder there, and it's connected actually to the duodenum right there, where it communicates with the duodenum as well. That's the one of the small intestines that comes right off of your stomach. So symptoms of an unwell pancreas. Typically, you'll get a lot of diarrhea, a lot of bloating, flatulence or farting. A lot of people say they have like foul, oily smelling stool. Weight loss can accompany pancreatitis, or an unwell pancreas, malnutrition, and then diabetes. You start to see really poor blood sugar control. Typically if it's an acute phase pancreatitis, a lot of abdominal pain, sometimes fever. Truly, if you're in the acute phase, the majority of patients really present very unwell if you're coming into like the emergency department. So, what really puts stress on your pancreas? Well, alcohol consumption is a big factor in that. It's not really dose dependent. You see a lot of patients, or at least I see a lot of patients in my surgical ICU. Some are chronic alcoholics, and for whatever rhyme or reason, throughout their entire life, they'll never develop some form of either acute or chronic pancreatitis. I mean, at some point, they probably will go into a chronic pancreatitis, but they never have an acute exacerbation of an acute pancreatitis, interestingly enough. So, what one person could drink, the other person could not drink as much, and that person would develop an acute, illness of the pancreas, versus the other person just never developing anything at all. High fat diet. When your triglycerides get up to a certain kind of level, usually greater than 1,000, we start worrying about, hypertriglyceridemia inducing a pancreatitis, which can be not great. Being obese or overweight is kind of a risk factor, putting stress on your pancreas. Smoking, any genetic conditions. They found that kiddos who were found to have the cystic fibrosis are at higher risk of developing pancreatitis. And then kind of the organic processes of gallstones, obstructions, cancer, certain drugs, or unfortunately it just can be idiopathic, meaning we don't have a rhyme or reason. We don't have something to hang our hat on why you developed pancreatitis. We couldn't find an enticing event, or an issue with. Sometimes it's the crappy luck of the draw that your pancreas just got upset, inflamed, and starts kind of wreaking havoc on the organ itself. So here is a beautiful picture of a diseased pancreas. The disease process, really acute versus chronic. What happens physiologically to the pancreas when it's inflamed? Well, experimentally, we believe that the enzymes in the pancreas, this pancreas makes these enzymes, it becomes active within the pancreatic cells. And these enzymes should stay in the GI tract normally, but when the pancreas itself becomes inflamed and starts kind of releasing all of these enzymes almost on itself, what we call autodigestion, where the enzymes actually start digesting the pancreas itself, that's when we start to see profound inflammation, and then really a downstream of systemic complications can occur. In my surgical ICU, we see a lot of very, very sick acute pancreatitic patients, and the multi-organ failure that comes along with that can be very detrimental, very scary, very life-threatening, and actually your morbidity, mortality is highly increased if someone coming into my surgical ICU for like I said, multi-organ failure, and subsequently it can lead to a patient's demise, unfortunately. Again, the causes, the majority of patients, gallstones are the number one cause of pancreatitis. Alcohol is the number two. But instrumentation, it's not without saying, when I say instrumentation, patients go in and they say, oh, I need to have my bile ducts taken a look at. I have gallstones. I have this, that, the other. Some of these procedures are not without risk of developing a pancreatitis event after. So just something to be cognizant of, genetic factors, like I said, cancer, or simply we just don't know. And with gallstones, that with that being the number one, basically you've blocked a duct. If you can see in the first picture where there's, the gallbladder and it kind of communicates in and around the pancreas itself. If you develop a gallstone that's big enough to where it can't get through those ducts, you've already increased your risk of pancreatitis about 25 to 35 fold. The good news is you can, pass a lot of these stones on your own, but when you can't, that's when the pancreas and everything kind of gets, jammed up from a secretion standpoint, and these enzymes start to kind of just degrade or auto-digest around the pancreas and kind of start eating away at the pancreas itself. And really with alcoholics, about 10% of chronic alcoholics will eventually develop pancreatitis attack. Hepatitis A and D, Epstein-Barr virus, and then like we talked about, some drug-induced issues are also kind of a big factor in that. A lot of medications you need to be cognizant of that can really cause a lot of stress and a lot of issues for the pancreas as far as enzymatic processes go. And like I said, you can develop this into severe illness. This is typically what I see in my ICU. By the time, you come into my surgical ICU, you've got to be pretty sick with acute pancreatitis. The downstream complications that just come about are quite impressive on a pancreas that's pissed off. So let's talk a little bit about chronic pancreatitis. Again, this includes inflammation, fibrosis, irreversible loss of XCR and isolate cell function. Problems that eventually will arise include glucose intolerance, possibly overt diabetes, show up later in the course. A lot of people have malabsorption of fat-soluble vitamins, which can cause what we call steatorrhea or fatty poop. This usually shows up after more than about 90% of the pancreas has become insufficient. So about this time, you're already looking at a pretty significant, damage and breakdown to the pancreas itself. Some lab values that we do look at are the amylase and lipase. These can still be normal in the setting of chronic pancreatitis, but typically we use CT imaging to help kind of guide and determine any structural changes that may correlate with pancreatic impairment. So really down to the meat and potatoes, any supplements that can aid in pancreatic support. Again, this is more so for kind of the chronic patient. If you're in the acute phase of pancreatitis, I highly suggest getting checked out, going to the hospital, seeing a physician to make sure that this doesn't develop into something more serious, a profound acute pancreatitis. So these suggestions are more for a chronic pancreatitic support. But chromium picolinate, it really helps to stabilize the blood sugar, so offering some glucose support there. Garlic is used for antiviral and antioxidant support. Good calcium, magnesium in the chelated forms. It really helps to counteract any glandular disorders, which you may start to become deficient in. Pancreatin, which replaces the enzyme deficiency in pancreatitis, getting some of those enzymes that have been depleted in the process, the inflammatory process that's happening. Vitamin B complex, always good for an anti-stress vitamin. Choline, inositol, these are both fat emulsifiers that really aid in fat digestion. which can kind of help during this process where you're not releasing, in the GI tract, good enzymatic, breakdown of some of the fats that hopefully you're not consuming a lot of fats, but the fats that you do consume. Vitamin C for good free radical scavenger, vitamin E, zinc, coenzyme Q10, again for good antioxidant enzymatic activity repair. When you're looking at some herbals, burdock root, milk thistle, this helps really cleanse the bloodstream, cleanse the liver, and then reduce any pancreatic burden. Jax is happy. Dandelion root, which stimulates the bile production and improves the health of the pancreas as well. And then really incorporating a low fat and low sugar, that's supposed to say sugar, sorry, and limiting alcohol, if any alcohol, no alcohol at all. These are kind of core, we've known this for a long time, the low fat, low sugar, no alcohol, to help support, repair of the pancreas itself. And interestingly enough, just reading about probiotics, they're not beneficial in this point in time. The research actually was shown that individuals who had pancreatitis and were using probiotics actually had a more increased risk of death and problems that arise from probiotic use. So this would actually be the only time where I would kind of say at this point in time, let your body kind of naturally heal from a microbiome standpoint, and don't incorporate probiotics in the diet. And that's really it. Sorry, Jax is getting excited today. I hope this was helpful as far as just getting more information about, pancreatitis and ways to support a healthy pancreas. If you have any comments, suggestions, concerns, anything else you'd like me to delve further into, again, this supplemental support is just kind of a brief overview. There's lots of other supplements and herbals and remedies that can be used for this. If you want to learn more, just add some comments, like I said, down below. Otherwise, I hope this was helpful. I hope you guys are well, and be well.